prevention exercise offering look like? How does your care change after my family member have a fall? Do they have to pay more? Make that transparent. So many residents were so scared of that. So there's a lot that could be done, and I appreciate that. We appreciate the opportunity to share our thoughts.
Hey out there, welcome back to the Nursing Home Abuse Podcast. My name is Rob. I will be your host for this episode. Today we are talking about a study done on falls and fall prevention in assisted living facilities in Oregon. And we have the researchers, the academics, the nurses that conducted that study and did that research with us. That's Dr. Claire McKinley Yoder and Dr. Hiroko Kiyoshi-Teo to walk us through kind of what they found, like how the methodology of the study, all that kind of stuff. It's a really interesting conversation. So stick around for that. But before we get into that, it's time for the Nursing Home Regulation Question of the Week and another opportunity for you to win the Nursing Home Abuse Podcast coffee mug. Gene, can we throw the coffee mug up so people can see it? Nice. That's a good looking mug. It's a good looking mug. You just imagine it in your hand as you're drinking some coffee from it. How do you win that coffee mug, you might ask? Well, it's very easy. You're going to go to our TikTok, which is @JusticeForResidents, and you're going to look for the Question of the Week thumbnail. This particular Question of the Week thumbnail, as opposed to all the other thousands of Question of the Week thumbnails, you're looking for the one that has Spin Magazine on it. Spin Magazine. A specific Spin Magazine that's got Ani DeFranco on it. You're going to comment your answer to the Question of the Week as well as your favorite magazine from the 90s or 2000s. So mine was Spin Magazine. And the only reason why that was my favorite is because I was kind of inadvertently mentioned in a Spin Magazine once. They were doing an article about Ani DeFranco, who was like, I don't know what you would describe her, kind of like a acoustic folk singer lady, really popular with the specific segment of kids. But I was the only dude at the show, and in the article it was like the one dude, blah blah blah, and so that was me. So I was kind of in Spin Magazine, so that's what's my favorite. Always been my favorite. But it can be whatever you want. Rolling Stone magazine, Tiger Beat. Tiger Beat's probably a good one. Newsweek. Don't see a lot of magazines anymore, but comment your favorite magazine from the 90s or 2000s and your answer, and you will be randomly selected to win the coffee mug. The winner will be announced on Sunday on our website, which is schenkfirm.com/podcast/giveaway. Yes, schenkfirm.com/podcast/giveaway. The mug ships at the end of the month. All right, so difficulty level for the question this week, I'm going to say is medium hard. So if you get this right, go listen to some Ani DeFranco records. Under 42 CFR 483.25N, what must the resident be specifically assessed for prior to implementing bed rails? Is it A, mobility, B, fall risk, or C, entrapment? And that answer is C. The nursing home must assess that resident's risk for entrapment and asphyxiation before bed rails may be implemented. It's definitely something that's not very well known by the public, that bed rails can present a greater hazard for entrapment than prevention of falls from the bed. All right, so now let's get into the meat and potatoes of the episode. Like I mentioned, we have two guests. We got a panel. We got a certified panel today. So we'll do bio back to back. We have Dr. Hiroko Kiyoshi-Teo, PhD RN, is an assistant professor at Oregon Health and Science University School of Nursing. A dedicated nurse scientist, she focuses on fall prevention and improving quality of life for older adults. Her research, supported by national and local grants, explores how motivational interviewing and person-centered care can reduce fall risk. Outside of work, she enjoys cooking, camping, and traveling with her two daughters, ages 7 and 13. And we also have Dr. Claire McKinley Yoder. Dr. Yoder or Dr. McKinley Yoder is an assistant professor at Oregon Health and Science University and has been teaching nursing for over 20 years, most of those in a community setting. She has expertise in academic practice partnerships to address social and structural barriers to health equity. And they both conducted this research, which I'm going to tell you is called Fall Prevention Care Management, Implementation, and Outcomes of a Project to Reduce Fall Risks of Older Adults in Assisted Living Facilities. And that'll be linked in the show notes. So if you want to read that study in its entirety, you can. It's very interesting what they were able to find. And there was some ancillary benefits that we'll discuss at the end of the episode. But anyway, Dr. McKinley Yoder and Dr. Kiyoshi-Teo, welcome to the show.
Thank you for having us.
So I really want to kind of set the table for everybody out there. How did you both come to want to conduct this study?
Sure, I can take this one. So actually the impetus came from nursing students learning for their population health. So they were at that time, they were working with Gresham Fire Department and looking at all the EMS calls that comes through. And they were identifying that a large number of those calls were related to falls, which was surprising. And then the firefighters are like, oh, this is such a major issue these days. We rarely go to fire. We very often go to help people with falls. What's going on? And the students took a deeper dive, and then they found out that it was nursing homes that were calling a lot related to falls. So we were trying to figure out, students and faculty, what we can do and what the next steps were. And that's when I got called in and what can we do? And, part of the clinic will really have students work on care management aspect of nursing. Care management is a very important role that nurses have, pulling in resources together, education, behavior change. So it's perfect. Let's do something related to care management for fall prevention. And with let's target these assisted living facilities that's calling a lot for falls. And that's how it got started.
So walk me through, now that you kind of identified, like, hey, let's look into this and see what we find out. Like, how did you go about selecting the facilities? How did you go about getting the data? What was that process?
Yeah, so we had this really interesting program in place with school of nursing and the Gresham Fire Department. So we had an innovative thinker of the fire department who knew that wanted to improve the public health aspect of fire stations' role, and they were working very closely with the faculty in residence, faculty like Claire, who are assigned to this Gresham neighborhood. So they were able to share all these calls data with us as quality improvement projects. That's why we were able to identify like 10 top 10 assisted living facility from fire department data. And then we contact them and see if they'd be interested in participating in offering student clinical that would also have a research project aspect to it. That's how it got started.
That is amazing that the fire department was integral to that process. I would have never imagined that.
Yeah, it was really cool. Claire, I think you should speak to that. Yeah, you were integral to that.
Yeah. So they're one of our partners, and we have clinical students with them every term, really addressing non-urgent calls, because the majority of the calls that they get are not somebody having a heart attack or a stroke. It's, somebody who's fallen, somebody who really doesn't have the resources to, manage whatever condition they have. And they don't have anywhere else to go. So they call 911 because they don't know what else to do. And so that's one of our clinical placements, and they make referrals to us. And as Hiro said, there were quite a few falls that had been happening, and they were like, this is a thing we're seeing a lot. And especially, in the assisted living facilities, there's the people may be hesitant to reach out. There's a lot of shame involved with falls, and so people don't want their family to know. They don't necessarily want to talk with their primary care, things like that. And so and Hero has done this fall prevention research in other settings, and so thinking about how can we decrease some of the stigma, and then also this is really valuable learning for students. Some of the, like when we were looking at the literature, a lot of students don't get much in the way of this kind of multifactorial look at fall prevention. It's like use a walker. It's pick up rugs, but it's not all the other things that were included in this. And so I think it was a really great opportunity for both student learning and for addressing the issues in the community.
So was it mostly like interviews, or like how were you, like you're sending the students in there to talk to people once they got like the police or the fire department's emergency report or something like that?
So I can talk about that. So what we did, so once the nursing home said yes, we can partner with you. So we went and we said, tell me who of your residents are at high fall risk and who's falling a lot. And then they would identify people who are at high fall risk, and then we would reach out to them to see if they would be part of the clinical and also be part of research. And because of the research element, because one of the outcome relied on surveys, we did need to include people with enough cognitive skills to respond to the survey. So we had to leave out people for that reason. But we had a total of 25 individuals across 2 assisted living facilities who met the cognition criteria, who were identified as fall risk, had a fall, and willing to participate. And then pair of students, 2 students were assigned to 1 resident, and then they will visit them every week during their clinical for 1 hour for 5 to 6 weeks. So they would develop a relationship over time. And then the first 2 visits were pretty scheduled. So every nursing intervention starts with assessment. So the first 2 visits mostly focused on assessment, physical assessment, because of functional, right? Strength and balance, vision, nutrition, sleep, mental health, all that assessment, and also the rapport building, right? Building trust, because we're going into each resident's room, their private space. So we really, and talking about something that's threatening to them. A lot of, like Claire said, not many people want to talk about falls. So we needed to establish time to build trust so that the resident feel comfortable enough to, share their thoughts about their fall risks and their, innermost thoughts about what they need to do to keep them safe.
So the $64,000 question is, after that 6 to 8 weeks of the clinicals, of the interviews, of looking through the data, what are some of the things that you guys found? Like what are some of the things that potentially are causing these falls? And as Claire had mentioned, what are some of the things that maybe we're not thinking about that would reduce the likelihood of falls?
Right. So there were many things that students identified. And for this study, we really wanted to make sure it's interprofessional because fall risks are not caused by one thing, but it's a layer of risk factors, right? So low vision combined with lower ability to maintain balance and their environment, new environment. Maybe they're getting more forgetful. So each, factor contributes to high fall risk. So student assessed all of them. And so we also had expert consultant, pharmacist, nutritionist. So for a resident who had nutritional needs, a lot of residents have very poor nutrition. Their weight increases or they decreases, just very poor metabolic health. So for that resident, the students worked with the dietitian team to work on a diet menu that would work with her appetite and her tremor to help with that. We also worked with residents related, it was a diabetic patient on diabetes blood sugar management. because she didn't like the food that was provided, so she was eating her own snacks, and that wasn't helpful. So things like that, to coordinating medication management, talking to their provider, involving family members to raise a question. This resident is on 10 different meds. Is this all appropriate? And then really coaching patients to have a conversation with their primary provider about potentially changing their sleep medication, because that's a high fall risk medication. What can we do about it? So they worked on all various aspects of fall risk management.
I would have never thought about the nutrition component being a factor in falls. What about the issue of toileting or rounding for toileting? Was that it?
Yeah.
Did that come up with the students?
Sure. Yeah. Toileting major, falls in the bathroom is a major source that it happens. So for a frequency on timing, and then also related with elimination, right, is intake. So a lot of older adults don't take enough fluids because they don't want to go to the bathroom as frequently. So kind of balancing things out, try to hydrate earlier in the day and drink less at night, or type of fluid. They may be drinking a lot of coffee during the day, and that's not very helpful and makes the person wants to go to the restroom more. So working towards that. And really for one of the resident with a serious like colitis issue, really revisiting that issue and bringing up to their providers to really reassess that and not let it pass as a norm for that resident.
This is all amazing. So when the students are coming up with these ideas, okay, let's make sure that resident A has a higher calorie intake, or we make sure that she has something she likes to eat. Like we'll bring some whatever from her granddaughter will bring in whatever. These things are going into the care plan, I imagine, and then we have data in terms of falls after that. So kind of where did the study go after that? Was there an effect after all of these interviews of 6 to 8 weeks and changing things about? Like did it have an effect?
Yeah. So we did want to measure impact of this intervention. Falls, of course, we wanted to get there, but the reality was at that time, because this was pre-COVID in Oregon, the data related to falls were collected very inconsistently. There wasn't a mandate, and maybe, it varies by state, but we didn't have a reliable source of fall data collection, definition of falls. So that's actually something that we worked closely with assisted living. And again, here we are also building trust and rapport with assisted living management as well. Because they're trying to do their best to keep their residents safe, but they are so under-resourced. We were shocked. I'm a medical surgical nurse by background. In hospitals, we have quality officers whose job is dedicated to keeping patients safe, and data analysts who would knows ins and outs about definition and keeping track of things. No, these people had handwritten notes about when residents fell, and they're hard copied, patient charts. So it really wasn't reliable. So what we relied on were one of the thing called concern about falling, falls efficacy outcome. So it's a self-reported outcome. It's researched a lot, and it's basically 7 questions that ask about how concerned are you about like getting up from a chair, going down the slope or stairs. And the higher level of concern, it puts them at the higher risk for falls. So we were trying to see if their concern about falling would decrease. Having had students care management visit, we also thought their confidence to decrease their falls will increase, and maybe their importance to prevent falls would also increase as well. So those were the outcomes that we measured for this, fairly small scale study.
I feel like it's and I said this before, but assisted living and personal care homes, I feel like, are kind of the wild, wild west. There's no federal regulation, as y'all both know.
Yeah.
It's state by state. And even with federal regulations, with like what constitutes a fall and things like that, the resident assessment instrument that's uniform across the country, you still have one nurse would define a fall differently than the next nurse, let alone assisted living where there is no federal uniform definition.
Right.
So I can imagine how difficult it is and how probably frustrating as researchers and nurses to, you want that data, but a lot of it is not necessarily accurate.
Right.
Like at least with nursing home residents, you at least might have the MDS assessments that are pretty standard, but
I think my perspective is really looking at like that student learning and student experience. And I know that's not necessarily the purpose of this show, but I think that making those connections can kind of I think one thing that we found is that when the students were meeting, they were working really closely with the resident care managers and with the nursing aides, and talking with them about, okay, so here's what we're working on with this person. It would go in the care plan, but it was also um, it really benefited the people working there as well, because you have these students in there who have all these ideas, and then you have the faculty also who are kind of bringing in new ideas, and I think sometimes it can be hard because I think there's something here in Oregon like 400% turnover in staff. And so that can be really hard to have really well prepared staff to do to do this work. And so having students and faculty in there can kind of support the professional development of the staff. And also, we had a person who had not gone down to dinner in months. She would only go in a wheelchair, and by the end of the 8 weeks, she started getting up, and she would just walk with the student. She's like, "Oh, those nursing student boys are so cute. I'll walk with them," And so sometimes it's just having someone new, someone who can take some extra time, to be able to really kind of get into what are the big concerns for this person, and build that rapport. And I think that resident care managers and CNAs definitely do that, but so I think there's a benefit of students being able to come in because they just bring a whole different lens and energy and all of that. So
yeah,
I think it's a really valuable opportunity.
of course, if two nursing students come to my office every day and asked me about how I was doing and how I was doing my life, I would feel way better. Like I can't even just the psychological component, forget the fall prevention stuff, just the psychological component of two people or however many people coming in every day or every week or whatever and asking about the person and being concerned about how you're doing. Man, I'm on top of the world now. That's so just that alone is amazing. And I can also see your perspective as well about then you potentially have the staff, which is probably maybe temporary or whatever. They're like, who do these kids think they are? When they leave, we're the ones that have to do the real work or whatever. So I can definitely see a little bit of that conflict. But this sounds great. I'm so happy that you both are doing this type of research and do this type of work. It can only benefit everybody in long-term care. So I really appreciate you both coming on the show and sharing your knowledge with us.
Thank you so much for the opportunity. Yeah, we hope things like this could expand, and we'll be happy to be resources to anybody that's interested. Right now, we're also doing a community fall risk assessment, inviting people to come semi-annually and involving nursing students to do that as well. So we just need to make it normalize, that falls are preventable, right? It's not something that should be tucked under the rug, but something that could be actively worked on, and asking if the family is looking for a new, home for their adult parents, ask about what are you doing for fall prevention? How are you keeping your residents active? What are your, fall prevention exercise offering look like? Does your care change after my family member have a fall? Do they have to pay more? Make that transparent. So many residents were so scared of that. So there's a lot that could be done, and I appreciate that. We appreciate the opportunity to share our thoughts.
No problem. Very well said. All right, folks. I hope that you enjoyed this episode. If you have an idea for a topic that you would like for me to discuss, please let me know. If you have an idea for a guest that you would like for me to talk to, please let me know that as well. New episodes of the Nursing Home Abuse Podcast come out every single Monday. Also, be sure to enter the contest to win the Nursing Home Abuse Podcast coffee mug. Let's see. I guess that's about it. This is actually my last recording for this season, I think. I'm not sure when this comes out, but I think at this point I've recorded 60 episodes in a matter of a couple months, 2 or 3 months. So this feels kind of wild. It's like almost like a send-off, but not quite, because I'm not sure chronologically when this episode comes out, but you can tell by my voice I'm kind of beat. But anyway, we'll continue to pump these episodes out every single Monday, folks. And with that, we'll see you next time. Thanks for tuning in to the Nursing Home Abuse Podcast. Nothing said on this podcast, either by the host or the guest, should be construed as legal or medical advice, nor is intended to create an attorney-client relationship between the host or their guest and the listener. New episodes, for now, are available every other Monday on Spotify, Apple Podcasts, or on your favorite podcast app, as well as on YouTube and our website, nursinghomeabusepodcast.com. Again, that's nursinghomeabusepodcast.com. See you next time.